percussion skills?
Es como conmigo, que nos mira así para arriba.
Watching him do it seemed like.
Y como
Yeah, but
ven en el
does everybody
examen,
feel like they can
para abajo.
percuss?
Yeah,
You want to try percussing the table? He does the middle one. You could do like the first one. You can just try it with your finger. It's really about the finger. It can't be a rigid. It has to be like a movement in the wrist.
Yeah,
It's not like moving the arm like this. It's like you're really. See, the wrist is really kind of moving.
Minnesota.
Hey, your knuckle. You gotta soften that hand.
You hear the difference too? You can find. I said you can find the studs in your wall, right?
My
So when it's more.
Listen,
Feeling it there.
Yeah. See how it changed gears? I
So
heard
when
that.
it's,
Listen, you hear the difference in the sound?
yeah,
So there you go. So that you can percuss your wall, and then you can see where that is.
so when it's more dull, then it's like
More solid.
dull elevation, and then if it's like hyper resonant, it's like more like air or.
Unless, like you said, unless you might be over the liver, right? Remember
Well, yeah,
those
I know, but I
positions.
mean like a normal
Right.
part of
It
the
should be
body.
resonant.
Right, but if it's
And
hyper resonant, then it would be like air or fluid, or.
Well, it's going to be considered like more air, right? Like maybe an emphysema, something where your air traffic would be hyperresonant.
And
It's
the
not easy to
dull.
tell hyperresonant unless you're feeling what resonant is, and you have to have a comparison of what dull is and
Right.
flat is. On their tympanic, like a hollow organ as well, so more like a drum.
Okay.
And you know, and the stomach only sounds kind of like a drum when it's not full. So,
When it's not full, when it's empty.
When you feel all those areas, one, two, three.
so right, so this is where we're looking at. This is the proper technique to do this, right? There's a procedure to auscultate, but how many people just auscultate
Yeah.
like a crazy all
I
over the
know,
place, right?
I
Like it
know.
looks like they're throwing darts. I think that's really what. If you kind of teach this or know this stuff, you're like, wow, people really.
Mm-hmm.
This is a skill that people don't do. Flatness would be something like over muscle, right? Dullness, they say more like a solid organ, like liver. Resonance, it should be the lung. Hyperresonance should be a little louder. And then tympanic would be an air bubble. It's kind of hidden behind these. So we felt the need to have more.
Sometimes physicians like they'll percuss if they hear something, and they'll like percuss maybe one side and then the other side. Not all those fields.
Okay, you've had that experience.
I have.
That's cool.
Not me personally, like on me, but I've been with a physician who has done
That's
that
pretty
to
cool.
a patient.
It's not common, right? It's not
It's
common.
not.
and
They're
it really
old.
is just
It was
like-
an old school
it-
physician that I
An
saw
old
do
school,
that.
right? I've
Yes.
seen some people do great things
Yes.
with reflexes and assessing like thyroid function and stuff.
Yeah.
Most people are like
Nowadays.
just banging away or not doing. Really, it's really a skill that doesn't get utilized that well. And it's if you don't practice it, if you don't have patience, you keep repeating on, you lose the skill.
Mm-hmm.
And then you're really just we're documenting great documents, but we're really
Exactly.
doing poor performance on it.
Exactly. That's what
So-
happened.
And my
So
first
healthy lungs are
pediatrician,
resonant. You should know that. That's a note.
he retired.
Resonant.
I
Right.
used to que estaba ahí con la doctora de la hora. He did that to my son.
So if you do
too.
have fluid in there, you
When
might
I
hear more
found out.
dullness on there, right? So
You know what he told me?
auscultation
Yeah.
again has a
He
technique
goes,
for this.
"Con la
You know, we say to do it with the diaphragm and the bell. Some stethoscopes
Oh,
have
sí.
both features in it,
Caliente.
depending on how hard you press. You just kind of know what you're doing with
Antes que
that.
antes, para darle immediate relief.
Mm-hmm.
So,
Yo le dije,
so we know normal breath stuff. Vesicular is heard where over. What sound is vesicular? Where do we hear that? So that's so that's what we hear is long sounds that we think about that. Bronchial is heard over the trachea, which is where's the bifurcation?
Eso es la
Sternal angle.
T4
T4.
and T4 is determined by
Second intercostal.
right. So they connect and it goes in the back, right? Well, you know, so that's over the bronchi, right? Because tracheal is a slightly different sound. That's easy to kind of listen on yourself. This is a good, you know, to practice on yourself. Just hear how those sounds do it. You know, bronchiovesicular would be at the bifurcation, right? In those areas of the areas, right? So coming around here. So a little lower, like 3 and 4 in that area, coming over towards like the middle. Very well. This is okay. That's a question. How do you auscultate a woman who does, you know, especially if they have larger breasts, right? How would you do that?
It's hard.
it's a challenge,
Mhm.
right? You can always document the limitation of your thing, right? I tend to wanna go under, because you really can't.
Yeah, we can go, or
Right,
very above.
I tend to ask them to hold their breast up, right, rather than me hold their breast up,
Yeah.
you know, just it kind of feels, you know, seems better that they, if they're managing their business, and I'm just kind of doing that part, right, but there may be parts I don't access at all, but I can say that's a limitation of my,
Mhm.
exam.
How
Yeah.
exactly would you write that when you're,
Well, you would note that the woman had, breasts that, you know, interfered with the exam, I mean, so, which is perfectly fine. Right, you might say what areas you think you could not assess clearly on there. But you can try to get up as far as you can listening to it, but there's gonna be some limitation over it on it, and that's fine. I mean, you can't do what you can't do on that, right? But you still can access parts of the lobes on the side, and then of course in the back.
Dr. Sacco, is it common to separate the bronchial and the tracheal? Because in the shadow health, it doesn't.
They say they're very,
Yeah.
yeah, they're very similar, right? You know, it's probably like, just like a,
Slight,
the slight
in the
variation
patient.
on that, right?
So.
What?
Sometimes you do see them together, like I say, but,
yeah.
you know. But it does change, the trachea does change its slight characteristics as it becomes a bronchi, you know, as well, so. So we also have the skills where we auscultate, so let me see what we know here. So what's bronchophony?
When you're auscultating and you tell the patient to say 99, and if it's clearer or louder, that's abnormal, it's the problem.
Okay? Right, so we ask them to speak like in a normal tone. If we hear amplification, right? We might think more consolidation, the same way about the vibration. We think on that, and it should generally be kind of muffled when people do that. And that's something we can practice. Egophony,
That's when you have them say E,
Bronchophony
but you
is
hear it as
muffled.
I.
E, or A, or it's like a nasal,
Yeah.
something like that, right? E becomes kind of an A sound on there, right? And normal, and E should kind of sound like an E. It's not gonna sound as clear as someone's voice, but it's gonna have that same sound. And if it changes, you're thinking some
Consolidated.
consolidation is out there. Whispered pectorililoquy. And you gotta try these just on your patients, just try them. Every time this is especially when you have cold season and flu season, just do it on these people. They'll think you're real bright or something like this, or they'll just think you're a dull student doing these silly things on them, right? So how does whispered pectorililoquy work?
You have them whisper words. And if you hear it louder, you get
Yeah.
consolidation.
Could be like 99, people suggest. And it has to be a real whisper, not that loud whisper thing. Right? And see if it amplifies the sound. Really, if it's a whisper, you shouldn't really hear it at all. So we're all familiar with different sounds, right? Yeah. Anybody have questions on different sounds? So we listen for them all the time as nurses, don't we?
Yes.
And we know stridor as well too, right? So we, we're thinking of an obstruction higher up as well. Okay? So these are just things where we might hear different sounds. This is a precordial crackle that relates with the heartbeat and not necessarily the respiration. So you want to try to listen to the heart sounds. You want to listen to the respirations as they relate to the breathing, right? And as they relate to the heart sounds, if you're near the heart to hear it. In the back, you may not hear it as well too. But so those are kind of two things to keep in mind. We talked a little bit about these. This is just kind of a chart on this, right? So you should have some familiarity with this, right? And when you're going to hear these sounds, when we might expect how a gophony would be, for example, or whisper pectorililoquy, or whether it's vesicular or bronchovesicular, or wonder what. And I think we're all familiar with normal breathing patterns as well too. we should kind of be familiar with when these breathing patterns might occur. Okay, so we talked about examination of the chest, we talked about chest expansion already. Again, tactile fremesis, as though we didn't get enough of that. So location for percussion and auscultation. There it is, you see?
Oh,
We asked the
there it
question.
is.
Ningún doctor hace eso.
Go, you asked the
Ninguno
question.
hace eso. Todos están con miedo que se les cierre
Oh,
la azúcar.
they're percussive.
Dicen eso. Ninguno se
He's
hace.
going in whether she likes it or not there. You know? Kind of laying him down, but he's at the border. He can't go not much further, it's not gonna be of use to there. I guess he decided to lay her down, would be better, right? I mean, you would think that was a good idea. So, okay, so, just a lot of, same old thing being said here, right? What we expect to find. So we talked about some of the respiratory symptoms there. And this is more like if you're pulling lung exudate on there. This is not something you're going to actually see. This is not what people cough up. All right, so this is not related to that. This isn't actually they're pulling fluid from the lungs and how they might relate differently. So, okay, so these would be the causes of transdates versus exudates. So in general, like I said, if you're in acute care, you may be doing this and seeing these results, and if you're in primary care, you're not doing these things. You should have familiarity with it, because you may do rounds in hospitals, so you at least know the terminology on it also. So we want to go inspection, palpation, percussion, and auscultation. That's kind of where we're going. So, and these would be the findings you would find for each condition. Unless you think it would be useful for me to read them to you. I don't think so either. So this is an easy section one, right? After cardiac?
Yeah.
This is like, whoa, hello.
Let's hope.
No, we didn't hope, you're living it. You're living this here.
Let's hope.
Okay, so the same kind of things. Just become familiar with this, right? Because these would be things we would be expected to know. Right. And if you don't know it now, right, this is why we practice. This is why we kind of learn this. And when we get out and practice, we start to look for some of these things. And if you continue when you get out and practice to do good inspections, do good examinations, you may find that you actually find some of this stuff. Right, and it can be done very quickly, these exams. So did this one, yeah? Okay. So these are the things, or causes of acute and chronic ones and progressive, and these are the 6 P's that you might think of. Possible foreign body, pulmonary bronchial constriction, maybe like asthma, pulmonary embolism, pneumonia, pneumothorax, and pump failure. CHF. Okay, that was pretty easy, right? So, that's all actually the slides for today. Did anybody want to practice today? Or is there, so at this point, we can take a break for a few minutes and then go practice some. If people want to practice the skills, even if for a half hour or for whatever you want. Or we can just go home.
Yeah.
So I'll leave it up to you. Does anybody want to stay and we can practice some things? Party